Cheers.
And welcome to Wine Wednesday with Criz Physical Therapy. I'm Dr. Tiffany Criz.
And I'm Dr. Mike Criz.
And on today's episode of Wine Wednesday, we are going to tackle the question of risks and benefits of pain medications while you're having an episode of low back pain. And most everybody, not all, but a lot of people will go directly to their little medicine cabinet or drawer and pop a couple of Tylenol or ibuprofen or naproxen sodium, something that you can get over the counter, maybe a hot pack or some, one of the bombs like an icy hot or something like that when they have an initial onset. And that isn't necessarily a bad thing as long as they're not overdoing it. And you need to make sure that you are properly hydrated with water and you've got good nutrition so that your body can actually metabolize the medicine. But there are times where that is kind of used as a crutch, I guess, would you say, Mike?
I would say.
Such as when somebody's out there playing golf. I know a ton of people that will say, when I get to the turn, I pop a couple.
Or even before they start.
Yeah.
As prophylactic, take some ibuprofen so that, it takes care of anything that might crop up,
right,
which gives you a false sense of security when you're swinging the club, and you might wind up a little bit worse after the round.
Right. The same thing goes for tennis. Several people will say that they might pop a couple before they go out to play tennis or right after, somewhere in the middle in between with their water. Another thing that we see a lot here too is that if someone has had, say, an acute episode, they stereotypically will end up going to the urgent care or to their physician. And a lot of times these physicians will prescribe a little stronger pain medication or even a muscle relaxer.
And muscle relaxers, they depress your entire system. So you wind up feeling fatigued or sluggish, even lightheaded or not clear thinking. And that's probably best if you're going to take them to take before you go to bed so that your cognition isn't affected. But unless you're really in an acute spasm, there are other ways to mitigate it that are probably more helpful, like a heating pad or gentle, subtle, soft movements to keep the tissues more pliable and help them elongate and shorten so that they can relax.
All right. Thanks for watching and
cheers.
Cheers.